வெல்கம் டு விஜே ட்ரெண்ட்ஸ். இந்த வீடியோவில் எம்ஆர்பி எக்ஸாமினேஷனுக்கு தேவையான கொஷின்ஸ் எல்லாம் டெய்லியும் ஒரு 10 கொஷின்ஸ் அப்லோட் பண்ண போகிறேன். இதை நீங்கள் கடைசி வரைக்கும் மிஸ் பண்ணாமல் பாருங்கள். ஒவ்வொரு கொஷினும் இம்பார்ட்டண்ட்டான கொஷின். கண்டிப்பாக கடைசி வரைக்கும் ஸ்கிப் பண்ணாமல் பாருங்கள். ஓகே, டைரெக்டாக கொஷினுக்கு போயிடலாம்.
Cigarette smoking can affect the circulation by the options are narrowing of blood vessels, over expanding of blood vessels, blocking of blood vessels, extravasation of blood. The answer is narrowing of blood vessels. The reason is the cigarette smoking, which is the chemical that is called as tobacco, which is send the signals to the heart to function faster and harder. Due to this, the vessels will get narrowed. So that is the reason the vessels will become narrowed. Which one of the following is not a sign of fluid overload? The options are elevated CVP reading, abdominal distension, dyspnea, bounding pulse. Among this option, abdominal distension is not a sign of fluid overload. The fluid overload called as hyperolemia. Answer is abdominal distension. The largest cavity in the human body. The options are thoracic cavity, cranial cavity, abdominal cavity and pelvic cavity. The answer is abdominal cavity. The reason is, first we have to know about the boundaries of abdominal cavity. The upper boundary is a diaphragm and the lower boundary is upper plan of the pelvic cavity. So that is why the answer is abdominal cavity. Appropriate position for a client with ascites. The options are sidelying, Sims, dorsal and Fowler's position. The answer is Fowler's position. Reason is the ascites patients will have abdominal swelling. The patient can comfortable with Fowler's position. So the answer is Fowler's position. Injection atrophin sulphate is given preoperatively helps to. The options are promote muscular relaxation, decreases anxiety and worry, decrease bleeding, inhibit oral and respiratory secretion. The answer is inhibit oral and respiratory secretion. About injection atrophin sulphate, it is anticholinergic, antispasmodic drug. It is treat the bradycardia and it is restore the normal heart rate while treating cardiac arrest patient. And this drug can be given before general anesthesia to reduces the oral secretions, and it acts as some antidote for insecticide poisoning. These are all the uses of injection atrophin sulphate. The primary functions of prostate gland. The options are to store underdeveloped sperm before ejaculation. Option B, to regulate proper sperm development. Option C, to produce a secretion and aid the nourishment and passage of sperm. Option D, to stimulate the production and maturation of sperm. The male reproductive system is consists of two main things, primarily prostate gland and scrotum. What is the function of prostate gland is, it will produces the secretion that helps to nourish and passage of sperm. And what is the functions of scrotum is, it is having testicles. The testicles will produces and store the sperm inside the testicles. So that is the functions of scrotum. And the answer is option C, to produce a secretion that aid the nourishment and passage of sperm. A client at risk for increased ICP, which of the following would be the priority for the nurse to monitor? The options are option A, unequal pupil size. The term we are using, anisocoria. Option B, decreased systolic pressure. Option C, tachycardia. Option D, increased body temperature. ICU nurse, especially neuro ICU nurse, we can able to answer this question very quickly. The answer is option A, unequal pupil size, that is anisocoria. How to assess the pupil size? The pupil will get dilated when dim light exposed. When the pupil is constricted, the bright light will exposed. Through that way we can find out the unequal pupil size. In neuro ICU, we can very well familiar with this unequal pupil size. Which of the following would be the important assessment findings for 8-month-old infant admitted with severe dehydration? Option A, absent bowel sound. Option B, pale yellow urine. Option C, normal skin elasticity. Option D, depressed anterior fontanelles. First of all, severe dehydration have the symptoms of dark color urine with a strong smell and depressed anterior fontanelles because of decreased hydration and decreased ICP level. The answer is option D, depressed anterior fontanelles. Meniere's disease affects the parts. Option A, ear. Option B, eye. Option C, nose. Option D, skin. First of all, what is Meniere's disease? Which is inner ear infection that will causes episode of vertigo. So the answer is option A, ear. A wound with uneven edges is known as option A, incised. Option B, bruised. Option C, punctured. Option D, lacerated. First of all, what is incised? Incised, it is a clean straight cut which is caused by the sharp edges. And what is bruised? It is scraps like wound. That is called as bruised. Then what is punctured? It is a it is a small hole and which is caused by the pointy object. So that is punctured wound. And what is lacerated? Lacerated is a deep cut and tearing of the skin. It may because of the accident with a knife. Tearing of crushing force will be there. So what is the answer is option D, lacerated.
இந்த வீடியோ பிடிச்சிருந்துச்சுன்னா லைக் பண்ணுங்கள், ஷேர் பண்ணுங்கள், கமெண்ட் பண்ணுங்கள். தேங்க்ஸ் ஃபார் வாட்சிங்.